Hi, everybody. This is Dr. Debunk, and I am going to do another little video today on the C19 infection and the issues. It's been a couple weeks since we did one that gave you an introduction. But as Dr. Debunk, I debunk medical myths, garbage, and crap spread by doctors and other health professionals. Well, today we're going to debunk the government and health professionals that are the experts on this, because there's some lies, assumption, and misconceptions that are floating around the news networks. And so I wanted to try to give you a little bit of truth from my perspective based on common sense and logic. And so let's dive into it. The first thing here is, look at my little list here, hand sanitation versus airborne. Now, there's this obsession going around that makes you sanitizing your hands almost more important than keeping your upper airway sanitized. This virus is airborne. It's transmitted airborne. The idea that there's any major issue with hand infection, I mean, that might be true for kids, but as an adult, you'd have to rub your fingertips all over infected surfaces and then lick them like you had cotton candy on your fingers or something. I mean, it's not that easy. Is it possible? Yeah. But they seem obsessed with having everyone disinfect their hands all the time, as though you could walk around doing this and the virus in the air would stick to your fingers like some kind of magnet, and then it would magically jump into your mouth or something. I'm not against that. So if you're out in the store and you were touching a lot of stuff in a public place, okay, wash your hands. But you got to remember, those hand sanitizers, it's basically the equivalent of poison. What's in most of the hand sanitizers is quaternary ammonium. So what that is it's a fancy way of saying it's supercharged ammonium. And if you use too much of that, it's going to eat your fingertips. I mean, you can essentially cause a lye burn. So use your common sense. If you don't touch anything that's not your own personal stuff, if you're just in your house, in your place, you don't have to go crazy every 2 seconds. It's airborne. And we'll come back to that. We'll come back to the airborne thing. So that's the first thing. Second thing that's going around that's a misconception, it's like, can you get COVID-19 from walking around outside? The answer is no. You can't. The air currents, even when there's no visible wind, disperses the virus. If you walk through a crowd of people that are all hacking, coughing, sick with COVID, okay, you could get it. But if you're 6 feet away from a crowd of people all around you, you can't get it. There's no way. People are locking themselves in their houses and not coming out. They're going stir crazy. I always ask my patients, how many kids you have? 4? And I say, do you still have 4 living children? Because they're all locked up and everyone's going nuts. Try to keep kids locked up in a house or yard. Go out. Go to the park. Go to wherever. Well, you're not supposed to go to parks. But do it anyway. Just stay away from people. The government's gone a little bonkers there. There's the misconceptions and the over-abuse of power. They really can't force you not to go out. Supposedly they're ticketing people, but what's going to happen is a lot of class action lawsuits. But go out, take your kids out, just stay away from people. Don't stay locked up. There's a Swedish study that suggests that it could even be worse if you lock people in the house if someone happens to be infected. So you can't get it outside if you stay away from people. You'll get it indoors, public place, the grocery store, whatever. That's where you need airborne protection. Okay, point number 3. Now this one's going to be a few minutes. So you got to pay attention because this is a medical topic and it's a little complicated. What is an infected asymptomatic carrier versus a true asymptomatic carrier? So all of this knowledge comes from influenza, but they are saying right now, the authorities, whoever they are, that 2 days before you get symptoms, you could spread COVID-19. So let me tell you how that works. On Monday, some knucklehead carrier monkey goes through the store and coughs up a storm, and his little viral clouds are everywhere. And you walk through enough of these invisible clouds to get infected. Okay. Incubation period means you're going to get sick on, say, Saturday. Well, right now on the CDC and every other government website, whoever, they will say that on Thursday and Friday, you could infect other people. And debunk, wrong. There is no medical evidence they have to support that. There's no studies. There's not even really case reports. But there is a reason they're saying that, and it might be possible. So here's why they say that. Because they've done this a lot with influenza, but with COVID-19, I've seen some of these reports where they have cultured people day after day. And so they find that 2 days before you actually get sick from COVID, you have a high viral titer in your nose, mouth, and throat. In other words, you can grow the virus out. There's a lot of it there. Now, these is only small reports, small studies. We'll see how much that's really true, how it holds up in the years to come. But the point is, because the virus is in your nose, mouth, and throat, they assume, and that's a big word, assume, that means by breathing and talking, you could infect the people around you. Because you're not coughing, you're pre-symptomatic. That's the words they use, a pre-symptomatic person, an infected pre-symptomatic person. Now, there's no studies to show that's real. The only way they could tell you that's true, absolutely, is they take a pre-symptomatic person who tests positive, we know they're sick, they're not having symptoms yet, and you put them in a room, like an isolation room, and you measure all the virus that they're talking and breathing out. They're not coughing, remember, pre-symptomatic. And then you could measure how much germs they spread over a specific amount of time, say 5 or 10 minutes, casual contact with another person. And then they would know if that was a high enough germ count to actually have someone else breathe it in and get sick. Never been done. Do you know we've never even done that for influenza? In all of modern science, never been done. And yet they talk and act like it's absolute science. All they know, even for influenza, and by the way, influenza, the worst time you spread the infection is after 3 or 4 days of being sick. Well, 2 to 4. Depends who you read. And they talk the same game with influenza, that a day before you got symptoms of influenza, you could infect other people. Wrong. Debunk. I've looked through all the medical database. There's only a few studies done, really, where they even cultured out the viral load, but they never really looked, could people by talking or breathing actually infect someone else? They infer it, just for safety's sake. And so I'm not against the idea. Is it possible that, say, a husband or wife could get sick? And they get infected, they get infected, and then over the next 3 or 4 days, their wife could get it from them by bringing it home? Maybe. But here's the problem. Here's the real problem where common sense has to come into play. Every year, how many Americans get the flu? Millions and millions. And millions of husbands and wife. One of them gets sick. So the husband is home playing whatever, mom, dad, and the wife is working. And she brings home the virus. And all that time, she is pre-symptomatic and then gets sick, 7 to 10 days. He never gets it. How is that possible? Even if they stop being intimate. You're not kissing me, you germ carrier monkey. Fine. And yet, half of these people, the spouse doesn't get sick. How is it possible that they're coughing, breathing, talking day after day after day, and the other person doesn't get it? So it's not likely by casual contact that you could spread this virus beforehand. And again, I'm not saying you shouldn't be cautious, but it should really be with people you have repetitive contact with until it's absolutely shown to be true. Okay, number 4, fourth thing on the list. The government experts, especially this Dr. Fauci that's on the COVID-19 team, the head infectious disease guy. I'll tell you right now, I don't like this guy. I don't like the way he talks. He strikes me as an elitist. He thinks that when he goes to the bathroom, sherbet comes out his butt. And he's been around a long time. He seems very smart, but he seems to have his own agenda. And this is why I say that. He has downplayed the effectiveness of quinine and Z-Paks during this whole time. And there's some other things, I won't get into them, but that's the main thing. And we'll come back to that in a second. But the bottom line is, people forget when they're in the public eye what they say. Well, he has been against this whole concept that quinine and Z-Paks could work at all against COVID-19. And yet, because of the internet and people's willingness to dig, they have the video floating around now of him when he worked for Obama in 2013. He's there on camera talking about the MERS virus, which is the cousin virus to this, COVID-19. In 2013, the MERS virus, that's the Middle Eastern one. It didn't really come to the U.S. It was less than 1,000 cases. Anyway, he was talking about, hydroxychloroquine is working very well against the MERS virus, and blah, blah, blah. Now, wait a second. How can it work back then when Obama was president, but now Trump's president, and it doesn't work? And, and then some other things too. I just don't care for his approach. So you should really try to take what he says as a grain of salt, because he's been embedded in the government for a long time. And so without getting political, how many of you really trust the government that much anymore and the longer people work there? So anyway, the fifth thing is what leads into that, quinine and Z-Paks. Most of you hopefully have heard about this. The quinine and Z-Paks may work against COVID-19. So let's back up. The general principle for viruses is that the antibiotics we use for viruses don't cross-react. In other words, when you talk about bacteria, penicillins, like there's a strong penicillin called Augmentin, it hits a vast number of bacteria, all different kinds, but that doesn't work for viruses. You have specific antiviral drugs that work against Ebola or hepatitis C, or the common herpes simplex 1 and 2, mouth sores and the genital sores. And so there are a couple different viruses that are viral antibiotics that work, but they don't work for other viruses. And so we have a new virus now, and there's no known antibiotics, et cetera, et cetera. Well, quinine is a malaria drug, if you've heard that. Haven't heard that yet. And Z-Pak's a common antibacterial drug. And so for a lot of reasons that I won't get into, they work against the COVID-19, even though they're not labeled as antiviral drugs. And actually, we've known this since 2000, at least implied. You can go back in the year 2000, and from 2002, there was studies done in the lab showing that hydroxychloroquine could kill herpes simplex 1 and 2. And then in 2013, they used it against the MERS virus. So anyway, the point is, many of the health professionals, the woo-hoo doctors from Harvard or Stanford, like Dr. Fauci, are downplaying it. Oh, there's no studies showing it works. It's all anecdotal. Now, that's a big fancy word. What anecdotal means in medicine, it just means that it's the experience of a doctor or a particular study group that this product works. But that's not science. That's not a controlled study where you look at failures and successes, blah, 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 placebos and all that stuff. Here's the problem with that. There is so much anecdotal evidence now. There's a lot from many countries in the world, South Korea, Italy, France, and now even in the US, that these drugs work to kill the virus to a certain degree. How much and how effective is what we don't know. But they're saying that, well, we can't use it because we don't know. That's just not true. Those drugs are going to change the course of this infection, which leads into point 5, which is, how long is this going to go? And how long do we have to put up with this? I'm really hopeful that by the end of May, things will really be looking back to normal. Most people should be back at work. And here's why. Right now, they've kind of put a freeze on the antibiotics. Like, you can't get quinine, even though it's a common drug. You can't get Z-Paks. The pharmacies were told not to dispense it. I'm not really sure who's lapped it all up, but I'm hoping it's the government and the COVID-19 team. They're not really doing it yet. We're hoping that in 1 or 2 weeks, there'll be some big announcements about this. But here's what can potentially happen 4 weeks from now. The testing will be really available. And that 15-minute test, where you get results in 15 minutes, will be readily available. For sure, most of the testing will be 24-hour turnaround. So here's what'll happen. You, at whatever age you are, you start to get symptoms, and the COVID infection seems to go fast. You get upper respiratory stuff, the fever, the chills, the coughing, like they say, and maybe even short of breath. Well, if you're older, you will get short of breath. And so you could get tested right then and there, 24 hours. I mean, to talk about having drive-through testing, you go to one of the drive-through stores, whatever, CVS, Longs. There's no more Longs. Anyway, what's the other big one? We got to name everybody. Walgreens. And they'll do a swab right there on you. And 24 hours, you have the result. Well, then you could get hydroxychloroquine in a Z-Pak for 3 to 5 days and really knock down the infectivity. And we'll know more by then with the different treatment protocols that are going on right now that they're looking at. We'll know how much to give people. And that will really stop this process of the infection running its natural course for 6 more months or whatever. And so I'm really hopeful that is real. These antibiotics are going to help. The testing will help. And so then we can hopefully get back to normal. So just to conclude, the most important thing for you to prevent infection is to be able to sterilize or keep sterile your upper airways. Your upper airways only have your normal germs. Well, the first thing, obviously, is exposure. So you got to be in a public place in a building, most likely, unless, of course, you invite someone over that's sick, and they're coughing, which isn't going to happen with most people. But the other way is, can you sterilize your upper airways? If you were exposed, let's say you were exposed to some carrier monkey person who was hacking enough that you got his germs. They act like there's no known way to sterilize your upper airways. That's not true. For example, if you've looked on the internet, there's a bunch of people pushing colloidal silver. Now, that's an old-time remedy, and it works. Colloidal silver kills all common germs. Now, I don't know if most of these solutions have 10 parts per million. I don't know if that's strong enough that if you sprayed the colloidal silver all over in your mouth, nose, mouth, and throat, it'd work. You have a couple other products that I won't name because I could probably get in trouble. But they're out there if you could find them. But the one product that, yes, is a sponsor of my programs is right here, KSK Cold Spray. This product is 4 years old. As I mentioned before, if you saw my other video, this product has been in beta testing for 3.5 years. This COVID thing has come along and the product has nothing to do with it. But based on the CDC's website that talks about the topical germicides or the hand disinfectants, basically, that will kill COVID, that list is actually the same list they've always had for common colds and flu, that it disinfects, kills rhinoviruses and coronaviruses and the influenza viruses, the common upper respiratory viruses. It's the same list. Well, KSK kills all those same germs. So there's no reason to believe that it wouldn't kill or inactivate the COVID-19. And what you can do with KSK Cold Spray is use it after you've been in a public place in a preventative fashion. Now, I have to emphasize this. This KSK is not a treatment for the virus infection. If you were infected, you couldn't use this to cure yourself. This is a preventative tool in the same way a hand sanitizer if you were dopey enough to somehow put your hands in some infected cesspool of COVID-19, and then you started licking your fingers, if you disinfected your hands with any of the hand sanitizers that are approved, you would kill enough of the virus so you wouldn't get sick from it when you stuck your hands in your mouth like a 6-year-old. The problem is, how do you do that to your upper airways? You can't spray alcohol or quaternary ammonium or any of these topical hand sanitizers in your nose, mouth, and throat. I mean, you can, but you will curse me if I tell you to do it because it will burn like fire. KSK doesn't burn. A little bit in the nose maybe for some people. But by repetitively spraying, you could disinfect your upper airways if you were exposed, and voila, you wouldn't have enough virus to infect you. So that's about it for today, but I just wanted to say that protect yourself in the public places, either with a mask and minimizing the use, and then if you have to, go get some KSK cold spray. Go on the internet, look it up. It's right there, kskcold.com, kskcold.com, and read all the information, and you decide for yourself whether you think this product is legitimate or it's snake oil. After 3.5 years, I'm convinced this product is legit. It's not snake oil. It does exactly what it says it does on the website. It's a topical disinfectant that you can spray in your nose, mouth, and throat, and you can prevent colds, flus, and from my money's point of view, COVID-19. Thanks. This is Dr. Debunk with another debunking of the medical myths, garbage, and crap that's spread by doctors and other health professionals.